Here. Okay.
Good evening, Endo Summit Live. We are thrilled to be here talking about policy and advocacy with the Center for Endometriosis Care's Heather Guidone and also Connecticut State Representative and author Jillian Gilchrest. Heather, welcome.
Hi, Happy New Year, everybody.
Do you
I
want to
can't think of a better way to kick off the new year than with you both.
introduce yourself?
Sure. So I'm Heather Guidone. I'm the program director of the Center for Endometriosis Care in Atlanta. I am a board certified patient healthcare advocate, endometriosis educator, activist, all around soup to nuts, chief cook and bottle washer. So it's great to be here.
Yes, I like that term, chief cook and bottle washer. I think
I do all things.
it suits us all in the advocacy world because we do it all.
All
Speaking
things.
of someone who does it all, the author of the recently published Feminist Advocacy and Connecticut State Representative Jillian Gilchrest, welcome to the Endometriosis Summit. Can you share with everybody a little bit about who you are?
Yes, thank you so much. So good to be with you both. And I agree, this is a wonderful way to kick off the new year. So my name is Jillian Gilchrest. I'm a state representative in Connecticut. I represent West Hartford. And I'm about to be sworn in on Wednesday for my fourth term in the Connecticut General Assembly. And I chair and founded our endometriosis working group at the Connecticut General Assembly. And yes, like you said, I have mine too.
Oh, we're triplets.
So,
if you're really interested, stay tuned till the end when we announce a giveaway that we have for you. I do want to, when you say you're about to be sworn in, I don't want to give away all the good parts of the book, but I want to tell everybody my favorite part of the book because I think it depicts your personality that I know. I don't know what you're like outside of work, but
She's fun.
at one point, you had to petition to get onto the ballot when you ran the first time, and there was a commotion a little bit where you had to make a switch from just getting on the ballot to doing that petition, and so you rallied everyone in your group, and you made sure when you hit the hallway, the press conference was about how you were gonna still keep going and not about how you lost. And I think that is the crux of everything that we do in endometriosis. Yeah.
yes. Yeah. Thank you for highlighting that part. Yes. So I decided to challenge a 23-year Democratic incumbent for state representative and anticipated I would not win the convention. I say that it is a convention, but I think when people hear convention, they think of the big, right, Democratic or Republican convention. At the local level, your convention, it was at the town hall. And I needed a certain amount of delegates at that convention to support me in order to get on the ballot. And if I didn't get that, which I didn't, then I would need to get signatures. And so anticipating that I wasn't going to win that, yeah, I had told everyone, okay, we're going to, as soon as the vote is over, we're all going to get up, we're going to walk out to the hall. You're all going to stand behind me with your signs, and we're going to speak to the press and let them know we have every intention of petitioning onto the ballot. And I agree. It's like you need to make wins out of your losses. And you need to stay true to your message, right? And to what your goals are.
Absolutely. So let's kick it off this evening on the endometriosis side. Heather, we'll start with you. Why is endometriosis a social justice issue? And perhaps you could sort of define social justice for our audience.
Well, I think that it was a social justice issue before we knew what social justice was, right? I mean, I've been doing this a really long time. And maybe we didn't know that it was a quote unquote social justice issue way back when. But when we're talking about things like advocacy and representation, we're talking about the voices of endometriosis that are particularly unheard, marginalized, those who've been sidelined by research, those who are not part of the conversation. And it's a very intersectional thing. It's about healthcare access and disparities, which I think anybody with endometriosis is familiar with. It's about awareness and education and the lack thereof and the propagation of misinformation. It's about an economic impact, and that looks different to different people.
Oh no. Oh no, her noise, her sound. We're missing all the good parts because your sound isn't coming through. All right. So you come out and in again. Let's see what happens.
Back.
And I'm gonna ask Representative Gilchrest, do you think endometriosis is a partisan issue?
No, not at all. So since starting the working group and having this conversation at the Connecticut General Assembly, in no way has it been partisan. And that's because it touches so many people's lives. And so I've stopped being surprised, but I was surprised at first at how many of my colleagues would come up to me privately and share that their wife or their daughter, had endometriosis, and they were so pleased that we were working on this. And that crossed the aisle. Also, women from both sides of the aisle. And so, no, it is not a partisan issue.
Heather, how's the sound doing? Still no sound. I'm not going to panic. I'm going to keep going. So I would like to establish, well, first of all, okay, she's going to try it again. So Representative, what drew you to working on endometriosis and trying to create change?
So interestingly, and I've been reviewing, like I speak about this in the book, I think once again, it's what drives me oftentimes is this injustice, but this hypocrisy. And so I met with a colleague and friend asked to meet with me. We sat down and because she said she had an issue she thought I'd be interested in. And she started to share her experience with endometriosis. And she shared what so many have shared, which is sad, right? It's the same. And unfortunately, yes, everyone's experience is different, but there's common themes. And so her whole life, she was told it was in her head. She was told she was being dramatic. Then fast forward years later, she can't have children. And they say, you have this thing called endometriosis. I mean, that's the shortened version. And so I left that meeting and did some research. And that's when I found, like 1 in 10 women? It's under-researched. And so once again, I'm like, wow, here's this issue that disproportionately impacts women that has been ignored. And so from then on, I was just drawn to it, the passion of needing to fix that injustice, quite frankly.
Yes.
Can you hear me?
We can hear you!
Sorry, I have no idea what happened. I'm so sorry.
So now I'm going to ask the tough question. Let's establish what needs to change in endometriosis. Heather, you first, and then the representative.
Oh, everything, right? What I started to say before is, when we come from a social justice perspective, it was probably social justice before people knew what social justice was. The intersection of.
She's gone. She's going to cry. No, we can't hear. You're saying pearls of wisdom, I'm sure. Okay, Representative Gilchrest, what do you think needs to change in endometriosis?
I'll echo Heather, everything. Well, so first and foremost, which I think is happening and has been happening, is the greater awareness. And so kudos to everyone who just keeps raising awareness and making this such a topic of conversation. Where I'm really drawn to right now is the coding. I know that we've talked about this, the coding and the insurance, because so I guess so many things. In Connecticut, what we've been able to do is establish a biorepository. And so we have a partnership between UConn Health and Jackson Laboratory, and they're looking to develop diagnostic tools and treatment. And so all these things need to be happening. But I suppose where then I go is federally, we need there to be a recognition in the healthcare world, because right now when folks figure out what they have, right, and again, because the advocacy and the awareness is increasing, people, okay, they might know they have endometriosis, they want to go get the appropriate surgery, and it's still not coded properly, and so they can't get that coverage. And so policy wise, I'm very interested in how do we push the healthcare industry, so the health insurance industry, but also the healthcare field, to recognize endometriosis for what it is.
Yes. So for the 87th time, Heather is here once again. We're praying that
I'm afraid. Can you hear me?
I can hear
Yes.
you. So in the book Feminist Advocacy, written by Representative Gilchrest, you state that change happens when people question the systems themselves. What do you think those systems are? What are the systems that need to change for endometriosis beyond just insurance?
I think
Well,
also, oh, sorry.
No, go ahead.
While you can speak, while you can speak.
I was going to throw in the whole burn it down thing because that's our theme this year, right? That's the theme of our panel. We have to burn it down.
Right.
But a lot of people talk about the system is broken, the system it needs to be fixed. The system is working exactly as it was designed by the people who designed it for the people who designed it, right? And what I mean by that is it's not working for those assigned female at birth or those with diseases or disorders or conditions that predominantly affect people with a uterus. It's not working for trans and other marginalized communities, BIPOC, LGBTQ. It's not working for those outside of that sort of health and wellness sphere. When you have a chronic disease, you have an expensive disease, when you have no access to care, when you're trying to decide between buying your prescription and putting food on the table, it's not working for those people. And those people are the majority. So when we talk about the system, we really have to pull back those layers of the onion. We have to fix, and Jillian and I have talked about this countless times, the coding issues, the reimbursement, the lack of inclusion on every level. We have to talk about ways to access better care. And that starts with training. So it's all interconnected. It's all intersectional. So the whole system needs to be burned down and rebuilt.
Mm-hmm.
Easier said than done, right?
And yeah, it's questioning who, like Heather said, who was the system built for? And it certainly wasn't built for women. And it certainly wasn't built for the diversity that Heather has just spoke to. And so what I also mean is when people are faced with like a denial, instead of just accepting, oh, that's the way it is, why is that the way it is? And then how can we do something to change it? And that to me truly is endometriosis. It's this layer after layer of, wait, why is that happening? And then that ramification impacts something else. And so when we're talking about systems in this context, not only, like you said, health insurance, but it is your political system. So who's representing you and why aren't they talking about this? It's your direct healthcare providers. Why haven't they been taught about this? And who's in charge of developing that curriculum?
Right.
So it really just keeps going. And so questioning, instead of just accepting, well, this is how it is, it's a questioning of why and how can we change it?
And how do we fix it? And everything is a challenge. It becomes a full-time job. It's not just getting to the doctor. Now you have to spend the next, 7 months of your life appealing and researching and writing that appeal and doing all of that work. It's about finding those doctors. It's about getting to those doctors. It's about the maintenance of treatment. It really becomes a full-time job. And the labor is always, always on the back of the patient. And I think that's true across policy, advocacy, healthcare delivery, and consumables itself. It's at every level.
Yes, I have a system that I think needs to change in addition to all this. I tried to write a caption for tomorrow's Instagram And why are we still trying to change the very foundational information about endometriosis in that the definition is wrong? And what systems hold that definition in place? Because it's certainly not us.
Yep.
Well, I mean, I think that if it's such a challenge, and there's such a lack of standardization and so many differing agendas and so many different personalities and so many warring factions within our community itself. Other diseases tend to have representation at the organizational level. They have not maybe unanimous consensus, but certainly standardization that's accepted. Endometriosis is a free-for-all. I could write a paper tomorrow saying anything I wanted about this disease, and it would probably get published, right? Whether that's accurate or not, and it would get funded. And that's really scary and sad, because on the other side of that are excellent researchers who deserve to get that ARPA-H funding, who deserve to get that NIH funding, who deserve to get that EndoCares Act funding. And they're not being funded because they're too small. People don't know about their work. They're kind of working in isolation. So there's a huge, huge inequity on the research side, not just within the funding sphere itself, but also who's getting funded, why are they getting funded, and what's their agenda. So there's a lot of that goes on, I think, that folks maybe don't know about. I don't know how you change that without making massive enemies, which we've done quite a few times. Maybe we're on a start with that. I don't know. But again, it's like peeling that onion. It's so multi-layered and so multifactorial.
The last time you were on, Representative, we talked about that policy and legislative efforts can really be a fantastic tool for standardization of language.
Yes. Yes. So that's when you're having this conversation, I'm thinking to myself, who are the entities that do hold the most weight at this point in time? Either when it comes to the world of healthcare, I guess, yeah, when it comes to the world of healthcare and who's looked at as the experts, and then if their definition is wrong, how do you get, and it is, right? How do you get the folks you need together to develop an agreed upon definition, right? Because that could still be challenging. And then how do you lobby for and push to get that all-powerful entity to use that definition? And
I was just going to say, I mean, I think that if we look to the World Endometriosis Research Foundation, they had a working group, they established a consensus by definition. People have to use it, though. It's there. It's the standard language: a systemic inflammatory disease of endometrial-like tissue found elsewhere in the body, yada, yada, yada. It's there. The work is.
Oh, no. Come out and in. Okay. So
to take what she's saying, though, what could happen then advocacy wise is if there is already this standard definition that everyone would like to use, it's then having, so I mean, I can speak to other things too, but with Connecticut, I could start putting that on our endometriosis working group agendas, right? Like that could just be a standard thing that when we start the meeting, we talk about that definition. We just remind everyone, this is the frame from which we're starting. And then we could use that language in legislation. We could speak with other states who are starting to do work on endometriosis and ensure that any policies they pass use that definition. So the more we're getting folks to align with that definition of endometriosis, that helps to get the better awareness and then to continue that push upward.
I think what's nice about that definition, not only that it reflects the inflammatory nature, but that it is not just reproductive based. So I went to my federal representative here in Florida, and who's a huge proponent of reproductive rights. Oddly, I'm in Broward County, so we're a little more liberal, and like a little bit. But they approach things from a reproductive background, and so when you use the definition that Heather's discussing, it approaches the systemic nature of the disease. Oh, we can't hear you. Okay, I'm gonna panic a little bit. In the book, Feminist Advocacy. Now, no, I read the whole book. So, but one of the things I think you have done really well throughout your career is make people who aren't necessarily interested in whatever policy it is that you're discussing interested in it, whether you've taken a different approach or you've been able to lobby not to make somebody care about a disease that's primarily about, not about, but a disease that includes menstruation, sometimes a hard sell. What angle, and I've had this conversation also with Dr. Chris Bobel as well, who we all love. But what kind of partnerships and angles do you think we should be taking with regards to endometriosis?
Great question. Thanks. So where I start, I have so many thoughts. With endometriosis, you could have so many various angles to be able to bring people into the discussion. So economic, I'll start there. Economic's a big one for a lot of people. And so the amount of time missed from work, right? Career paths not being able to be taken, not being able to go to school. So all there's tons of data on this at this point. Like you can quantify the financial impact of endometriosis. And so that can bring some folks in. Infertility is a huge topic. Now, I know when we're having, it's always important to say that like this doesn't impact everyone, but it does impact, right? 50% of infertility, I believe, please correct me if I'm wrong, but can be attributed to endometriosis. There's a lot of legislators, policymakers who would be connected to that issue. And so bringing them in through that route. Also, you could have the chronic illness. There's a huge chronic illness community, right? Who experience a variety of different chronic illnesses, but there's legislators and lawmakers who are connected to that advocacy world. And so to connect the dots for them through that. And then you're going to have also what I've already spoken to, you're going to have feminist women who understand how women's health has been ignored for far too long, right? You're also what you spoke, reproductive health. This is on that continuum. And so how do you bring those folks in? And so really when it comes to endometriosis, there are a variety of constituency groups who could come to this topic. And that's when you said earlier, it really is bipartisan.
Right. So I don't know if Heather's here. I told her to type.
Can you hear me?
I can hear you. Go.
Hurry. Ask everything at once.
So we're talking about what makes endometriosis meaningful to people that don't necessarily have the disease. What partnerships are out there for us? And I think that concept of missed work, missed school, because those are bottom line issues for a lot of people out there. Heather.
Well, it's about the economics, right? I mean, everybody understands money. They may not translate endometriosis into lost wages that come out of their pocket ultimately down the line. They may not understand that, somebody missing school is going to translate into later impact in life down the line, but it should absolutely, and you've all heard me say this before, it should absolutely be viewed as a priority public health concern, because it is. It's not just a period disease. It's not a killer cramp. It's a priority public health crisis. It costs society billions annually. So everyone should care about endometriosis, whether they know it or not.
What's it like when you go and talk to other members of the State House in Connecticut? What are people's reaction like when they hear you're working on endometriosis?
it's been actually really positive. I mean, there have been the reactions of they don't know what I'm talking about, right? So then it's explaining what the disease is and what I usually what the disease is and what the experience has been of patients, and how absurd that is since it impacts so many people. But truly, because it impacts so many people, the reaction has been everybody knows someone. I've also had the experience time and again of my colleagues who are maybe in their 60s or older, being grateful that this conversation is being had publicly because it was something that you just didn't talk about. And so that from male colleagues and female colleagues of thank you for moving this along. Because yeah, it just was, you just suffered in silence. So yeah, but there's been, knock on wood, no negative, no like, how dare you talk about this? Really just shock and outrage that more isn't being done.
I think that Representative Gilchrest is being very humble about her precedent-setting efforts and her working group. It's called the Connecticut Working Group, but she's got national representation. There are those of us there from every discipline. She's got legislators, she's got industry, she's got advocates, she's got physicians, she's got every represented, discipline there, really working together. I mean, when you look at what we did with EndoRise, with the biorepository, when you look at the agenda that we have for this year, I mean, it's challenging, but she's getting shit done. So I want you to toot your own horn. And it's such a privilege and a pleasure to be part of that. So thank you to you.
We actually
I'm
have
talking to your little square at the bottom.
right. We actually have Jack's Labs and also Dr. Luciano coming to talk this year.
Good.
Wonderful. Wonderful.
Yeah. I'm ready to gather samples, but they say we're not up to that yet. We're going to be gathering samples and opt in. Not everybody has to do it for one of the ARPA-H recipients. I think that's really great. So I am curious, who do you feel who's deciding who gets a seat at the table to help with some of these issues? First, Heather, while we have you.
Well, listen, yeah, I know. Let me hurry. I'm like jumping over myself before the sound cuts out again. Listen, everybody deserves a seat at a table where decisions about their health are being made, right? Now that's sort of a utopia. Let's all have a seat at the table. If they won't give us one, we're going to build our own table, and that's great. But the reality is we need the right people at the right tables for the right reasons. And sometimes that table doesn't look like you think it might look. I have found collaborations in the most bizarre places, at other disease communities, and there's this crossover, what I call menstrually adjacent disorders, because I'm the first person to stand up and say, this is not a period disease, stop it. But at the same time, there's so much good work going on in the menstrual space. If we can leverage each other, you want to do that. You want to work with collaborators who are like-minded that want to push the disease forward. Certain industry, people bring their own strengths to the table, but it's about amplifying the work of others. It should never be about, well, what am I bringing? It should be about, what can I do to help those who are there? How can I make sure that the voices are represented? And sometimes that looks very different than you think it might. And that's a really good thing, I think.
Yeah, and I think starting from, if folks know, if they don't know, like, who are your elected representatives? Who is elected to represent you? And from all levels. So your town or city council, your the Board of Ed, your state representative, your state senator, and then your federal, because I think there's a lack of education when it comes to civics in this country, but everybody has a local, you have your state representative, your state senator, and then you have your federal senator and your federal representative. And when they're running for office and then elected in, they're there to represent you. And so sending them an email, giving them a call, and letting them know that endometriosis is an important issue to you opens that door for conversation. Another piece too, if you yourself are in the medical field or have family, friends, neighbors who are, asking them what those decision-making bodies look like in the healthcare world that they're in, because there's constantly entities developing new curriculum, right? And in charge of education for healthcare providers, or folks, there's, doctors, nurses who serve on the state nursing association board, and so the more you have these conversations and realize that, you can also then bring this conversation up with them and see if they can influence those entities.
Yeah.
It's interesting because I did that, right? So I have an active tennis life. And so you meet people from all walks of life, but predominantly who have some sort of job or experience that allows them to have a hobby that takes over your life. So one of them sits on the New Jersey midwifery board. And let me tell you, like, completely uninterested in endometriosis, because the board only cares if you're gonna die of negligence. So they don't really like, my friend was very helpful, but so she was like, didn't want, wanted to take the approach that somebody should be trained in like decent care for endometriosis before they give advice on that, because that's safe to the public, right? We always have to, but if you're not going to die from me telling you not to eat gluten and it cures your disease, they didn't really care. It was very difficult.
Which, I mean, unfortunately, you're going to hit barriers, right? Oh, Heather,
Right.
we can't.
She's going to come out. And now the other thing is, I've had tremendous success. In the spirit of, we have to make other, it can't just be about the OBGYNs, because nobody's listening that much to them.
I'm so sorry.
Established partnerships with the American Urological Association, and they have tremendous avenues for advocacy that I never even knew existed, that are very well funded as well.
Well, and I think you're making a very important point too. Like, if one door closes, it doesn't mean it's all going to be like that. And so the example of the midwifery, that's unfortunate and frustrating, doesn't mean also that other people's midwifery boards, right, would be the same. And then, yeah, like, okay, try something else. And then even potentially circle back to that, like in a few years, because maybe some people have rolled off and other people, have rolled off. Like, so but yeah, I don't want people to think like, okay, that's how everyone reacts. No, it really is different based on who's in different positions.
Right. I think it's a matter of like, you have to keep knocking on the door.
Yes. Yes.
Yes. Heather, you've knocked on many doors. Oh no, certainly not the volume door this
Try
evening.
your phone. Can you put you have your video and then just log on with your phone with your vocal? I should have said that earlier.
Okay. So while she makes an attempt, I am going to ask, I'm a little thrown. I usually can roll with the punches. So I want to talk about some of the stuff in the book without mentioning the stuff in the book, but it pertains to endometriosis. Why do you think being vocal as a woman has a history of being an insult?
For so many reasons. I mean, the history in our country was that women weren't supposed to be in public spaces. So I'm very much brought back to the suffrage movement. That's something, it had its complications. It's something we can learn from, but it took a very long time for women to get the right to vote in this country. And not all women, I recognize that. But at the first women's convention in this country, when women were deciding, you know what, we want to fight for the vote, they still had a man chair the meeting, because they didn't think it was their place to speak in public. And so it's this, I bring that up because it is a long history of women being expected to defer to their husband, to their father. Um, and when we don't learn that history today, me saying that seems probably preposterous. Like, why is she like, that's not, but there is a history to this. And it's a brief history, truly, in our country. And so women speaking out and speaking up has been shot down for some time. And I think right now we're even seeing a backlash to that in the United States in politics. With as women have been more vocal on issues of sexual violence, for example, we're seeing a complete backlash to that. And so I think it's important for that to be shared in spaces so that women can prepare themselves for that backlash that will likely come when they do speak out, but to also know that it's coming from this like deep-seated place in American history, and that it's not a personal thing. And so to push through and to keep going because your voice has value and what you have to say is important.
What do you think, Heather? Do we have volume?
Yeah. Can you hear me?
I can
Yeah.
hear.
I'm like literally on an old school phone.
It's impressive. So how do we avoid being known as the period people? Like when we go up on the hill or we have a webinar or I try to talk to a sponsor who makes like a oh, those are the period people. Which carries this innate insult that they're calling us the period people. How do we avoid that when it comes to advocacy and endometriosis?
Well, for me, it's just about pushing back. You know, what we allow is what continues, right? And I already frame it as a systemic body-wide disease before I even get in the room. So I'm already laying the groundwork and the framework when I'm talking to their offices, when I'm talking to their aides, when I'm talking to whoever, it's the receptionist, whoever it is, legislators, companies, it doesn't matter, schools, you know, you name it. You have to define it yourself. You have to set the terms yourself so that before you're even in the door, they already know, oh, okay, so this is more than just a bad period. This is linked to other comorbidities. This is linked to other diseases and disorders. This is a really expensive disease. You know, you have to frame it the way that you want to be heard and correct it where you see it.
Yeah, I just want to jump back in when you're saying how do you avoid it, it's making me think like you can avoid it, right? And people are coming from their own frames and from their own background. Now, some people might just be being rude, right? And they do get it and they're still calling. But for a lot of people, if that's their frame, so an example in the world of gender-based violence, which I've worked on for some time, inevitably, I would say 6 times out of 10, when I go into a meeting to have a conversation about sexual violence, the individual we're meeting with says domestic violence. And it is a bugaboo in the sexual violence world because you're like, okay, they are different. But it's what Heather just said. You just kind of, well, actually, we're here to talk about sexual violence. And you like explain. And so it's the same thing. Like, actually, endometriosis is more than just, you just have to kind of correct them because over and over. And as frustrating as that is, it really is this frame they're coming from. And until you can change that, they're going to keep doing it.
I mean, listen, we have organizations and factions within our own community that do it. So I can't get angry or realistically expect that, Joe Schmo from who knows where has never heard the disease mentioned. I can't get angry and expect them to understand, all of this medical jargon the minute I walk in the door. Because we have very powerful, very influential, very wealthy organizations in our own midst that talk about killer cramps. So, we have to correct it wherever we see it. And like Representative Gilchrest says, you have to do it a few times. You know, you have to use the language repeatedly. You know, teach back, talk back.
Hmm.
I think you have to find the other people who, you know, sometimes we are going to preach to a choir that really is into that particular topic, and we have to link together with them while we're trying to make change in other areas too.
Mm-hmm.
So you know, what as an ad tonight is about advocacy and policy. Heather, what is being an advocate? Is it just having an Instagram account, or what really, what do you see advocacy as?
Well, you know what? For some folks, that is their level of advocacy, and that's great. That's fine. Everybody has a story to tell. They should tell it. You know, I always tell people advocacy is what you deem it to be. For some people, like Representative Gilchrest, myself, you, others in our core group, we're focused more on advocacy as agency. In other words, the rising tide lifts all the boats. The efforts that we work on at the CEC and that we work on collaboratively, they're for everybody. They're for the community. There's self-advocacy, which is, as Dr. Sonervo says, a very key component of your health and well-being. You must advocate for yourself. You've got to fight against that power imbalance at the doctor's office. You've got to fight against misinformation that impacts your care. You've got to fight against being silenced and not having your truth heard, which in turn could diminish your care seeking. And then there's advocacy for others. You know, a lot of the board certified advocates, they have private clientele. They have patients that they work with. You know, one very good friend of mine, she flew across the country and advocated for another friend of ours. One-on-one in a hospital situation, because that's what they do. So advocacy is really about, what does that look like to you? What are you hoping to get out of it? Are you looking to change and affect policy? Are you looking for better care for yourself or a loved one? Are you looking to make systemic differences that will echo for generations? What are you doing? What's your ask? What are you doing about it? So advocacy looks like several different things. You know, I mean, I wish it was as simple as sort of, you know, putting up a selfie on social media. I wish it was that easy and you know, as simple to do. But there's a lot of work that goes on behind the scenes that folks don't know about. And, you know, there's a lot of people working really, really hard on a lot of different projects, and most of us work on those together. So, yeah, I mean, if you are sharing your narrative and that's your level of advocacy, that's fantastic. The more narratives we hear, the better. The more voices that are heard, the better. If you are sitting in those rooms with us and you're standing up against people who are, you know, demonizing surgery or demonizing meds or demonizing this treatment or that or this therapy, and you're standing up against it, thank you. Thank you for being in those rooms. It really just depends on what it looks like for you, what you're hoping to get out of it.
Representative, anything to add?
No, I agree 100%. It really is, you know, finding what's your passion with regards to this, and where do your strengths lie, and not comparing yourself to other people. So yes, you know, have the endometriosis working group, and, you know, thank you for the compliments. Like, those are my strengths, right? Like, I love public policy. I am strong at bringing folks together and being able to turn things, you know, ideas we have into policy and then speak with legislators. That's my world. When folks in the working group bring up doing awareness activities and events for Endometriosis Awareness Month, I'm like, okay, you know, who wants to take that on? Because that is not a me thing, you know? So I know that about myself. I'll be there. I'd love to show up, but I'm not going to be the person to organize the event where there's tons of people, right? Like, that's their strength, is organizing a movie event, or, you know, there's just all these different ways you can advocate. I also speak to, in the book, like, the reason I went, what we call, I have my master's in social work, but I've always worked in macro. I do the policy, like, that's my passion. working one-on-one and hearing Heather say that, like, that is amazing. That's not where my strengths lie either. Like, I had seen that. I knew that in myself. Like, it takes a toll on me that I can't handle. And so for people who can do that one-on-one work with folks day in and day out, amazing. We need you. So I think too often we'll compare and think we're not doing enough. But it's all of us working together and sharing what we're doing, so that we can learn from one another, that gets us to where we want to go.
And I think the oldest form of advocacy is storytelling.
Mm-hmm.
I think that's one of the things, I mean, aside from Shannon Cohen being amazing, but one of the things that makes the film such a great tool is that it's storytelling, and that it had the ability to make people who maybe don't have endometriosis care. They felt connected to the topic. I think that's one of the things that made, for those of you listening that don't know the film that I'm talking about, we are talking about Below the Belt, which is a tremendous film, and you should go watch it. If you haven't seen it, you should see it. Yeah, but it's a great tool for conversation beyond our own community. Like, sometimes the Endometriosis Summit has a problem reaching beyond we can reach beyond in the PT world, but we haven't broken through beyond like our own community. It's very difficult. Yeah. So I always have to, since we're burning things down at our Get Fired Up Endometriosis Summit, March 28th through the 30th, I'm curious, what impact do you think performative efforts have? There's a lot of people out there maybe advocating for endometriosis or showing crazy Instagrams or, trying to speak for community for whatever reason that they have. But some of it is very performative. What impact do you think that is having on our movement right now? Heather, you first.
Well, I mean, I think we've talked about this. You know how I feel about this. I have a huge problem with exploitative advocacy. And what I mean by that is, for example, if you are simply appointing a patient to your research committee or naming them as an author on your paper because your grants are tied to patient-centered outcomes and you need a patient representative there, that's bullshit. Okay, that's not genuine. You're not really interested in what they have to say. You're not interested in their lived experience. You're simply putting a name there for performative reasons. I have a huge problem with that. I have a huge problem with exploiting organizations, throwing tons of money at them so that they will simply parrot and mimic your position on whatever agenda. Those are the performative things I have issues with. I don't necessarily have a problem with anybody, doing a March Awareness Month photo series on their Instagram. That's great. I want to see all your yellow ribbons. I want to see all of that. That, to me, is different than the kind of performative stuff that I'm talking about. When it comes to exploiting patient labor, using patients simply because you have to, using safe patients because you know they'll parrot you, those are the types of things that I object to. I think they're harmful. I think they're exploitative. And a lot of times it's happening amongst marginalized voices because you want to check off a box. I think that's disgusting. Those are the things I take issue and exception with. But on the other side of that, I think most folks with endometriosis are pretty savvy and pretty smart, and they're not going to fall for that. So I take solace in knowing that people are making good decisions about their partnerships and collaborations, and when they are appointed at those tables and they are on the stakeholder committees, that they will ensure that their voices are being heard.
Representative?
This conversation just makes me think again of how important it is to establish relationships with decision makers, because you're making me think. So I've done quite a bit of work in the anti-human trafficking space, and there's a lot of individuals and entities that will exploit that world, sadly, to make money. And they'll come in and they'll want to do these trainings, and you're like, who are you? But if the advocates who really are doing the work and understand the work, have created those relationships, the people in decision-making positions know to connect with you, right? And say like, hey, what's this about? What's this group? What are they saying? Why are they saying this? And so, yeah, to me, it's like, because again, I don't know how you stop it. Like having done now advocacy for a while, unfortunately, and as endometriosis continues to gain momentum, and I know it will, and understanding, those people are going to continue to increase, because that's how I've seen it in many other spaces. That like then they come. And so it's really about establishing those genuine connections with decision makers so they know who their point people are to understand what's performative and not.
Yeah, I think one of the issues is there's a lot of money to be made in endometriosis because we have not gotten the coverage or the access that we need. And so there is oftentimes some performative efforts out there preying on what they're building a base to cash in on, and I get annoyed with that. And I meet with sponsors and I meet with speakers and you know, it's a different type of job, but I do see it.
Yeah.
We
Our
have
body is
a
their business. No, you can't
yeah.
see it. Where's
I can't. Well, that's
our body's
I didn't
their
have that
business.
book. You have to send me that.
There's a whole industry built on the backs of patients.
Yeah. I have to read that one. So we have a question. And actually I'm gonna read you the question, but you have one of your social work interns is logged on who wrote you a very nice message in the Q&A. So are insurance companies getting better at recognizing that endometriosis care is not elective? And that's we could do a whole hour on why it's classified as elective. But why are hysterectomies not classified as necessary, but classified as elective?
Heather?
You want me to take that?
Yeah, you take it. It's been a long day for me.
Yeah.
So let me back up. I don't know necessarily that insurance companies are deeming it elective or not elective. What we're seeing real time is that anybody can do it. And this is the same problem that we've had since the dawn of time. I mean, this predates, back to when Harry Rich was fighting insurance companies. It's not necessarily elective or not elective. It is anybody can do it, including Joe Schmo down the street. And, Jane Doe, who has done maybe a 3-month MIGS fellowship, never saw a case of endo in her life, they can do it. So we're not going to pay for that out-of-network specialist. So there's still a lot of that going on. And what we see largely as a result of a very small but concerted effort to continue promoting that stepwise algorithm in terms of, well, have you done the pill? Okay, and then have you done GnRH analogs? Okay, then maybe you should have a diagnostic laparoscopy, which the entire world frowns upon. You should be doing a laparoscopy to diagnose and treat in the same encounter. So there's this algorithm that they're insisting upon, which, to their credit, if they know how to use the literature, they can exploit the literature in their benefit by saying, well, look, these guidelines out of Australia or France or wherever, they say that you should be doing all of these meds first, or that you don't fit in this box. You're not, this age trying to get pregnant or do this or do that. So you need to do X, Y, Z first. So there are still a lot of roadblocks going on in that. I don't know that I would consider it elective or not elective, but who can do it and what they can do.
Yes, I went to close the chat and I hit a button. I'm very sorry to our audience.
I saw this pop up on my screen. I got nervous. I was like, oh,
I know,
good.
I'm very, very sorry to our audience member. Especially when you read the book, you realize that sometimes comments shouldn't be open. Like, none of you have your opinion unless I recognize the name. So the Endometriosis Summit is March 28th through the 30th in Orlando, Florida, and virtually worldwide. We have a very exciting giveaway tonight. The fifth person, we always get a bump up in ticket sales after this. The fifth person to DM me a screenshot of their receipt for either virtual or in person will win a copy of Feminist Advocacy. And you can DM to either, has to be to Endometriosis Summit, either Facebook or Instagram, and you're going to win a copy. I will even go outside of the condominium complex and go to a post office to mail this to you. It's not my version, so it won't be marked up. You will get your very own version. And so the Endometriosis Summit is coming up March 28th through the 30th. Representative Gilchrest, aside from the book being on sale,
Yes.
what do you look forward to at Endo Summit time?
Ooh. Learning from new people, hearing people's stories, and building community.
Yes, excellent, excellent. And Heather, you are heading a panel on Sunday, March 30th, talking very much like we did tonight, really about burning down the establishment with a group of advocates who have done that with what they have. People like Shannon Cohen and Kate Boyce and Julia Mandeville and Akifa, who is a healthcare attorney. Tell me, what are you looking forward to the most about the Endometriosis Summit?
Just being in their presence, because they're my sheroes and heroes. The summit is really unique, and I have always loved what you've put together, and I know you put your heart and soul and every single dime you have out of your pocket into this event of yours, and we love it, and we love you for it. There's nothing else like the summit out there where literally every demographic comes together, every agenda, every personality, all for the greater good. I talked before about that rising tide lifting all the boats. That's what the summit is. There's no paternalistic notion that patients can't be in a room with a doctor, or a doctor can't speak to a legislator, or there's no kind of lines or boundaries there. We're all in that room together, figuratively, metaphorically, literally, because we want to make it better for the next generation. So I unfortunately had to miss it last year for health reasons. I am coming in person again this year, and I just am looking so forward to hugging everybody. Yay. Well, I'm looking forward to a mic that works and doesn't cut me out every 5 seconds.
Tickets are on sale, www.theendometriosissummit.com. And what do I look forward to the most? I think it's an endo extravaganza. It's really Endopalooza. And ticket sales are very increased this year. So if you're looking to come, especially in person, you better book that ticket. I think the hotel is almost sold out. And we haven't even started with Endo Summit Spanish yet. So that should always be interesting. But I think the other thing is that I'm looking forward to being with people in this community who have the disease, not who just treat it, but who really have lived the walk and talk the talk, live the walk, talk the whatever the thing is. So thank you for joining me. If you are looking to purchase Feminist, first of all, you could win it. Where my thing? You can win Feminist Advocacy by DMing me at Endometriosis Summit your receipt for either in person or virtual, or you can purchase on Amazon. And Heather, we'll have you back to discuss the other books soon with volume.
That was like a week for that discussion. I mean, we do talk about that all the time. That's our major focus of topic. But no, I mean, I think, anytime we can get Representative Gilchrest in a room virtually or otherwise, it's a good thing. So
What do you think the
I feel-
Connecticut Working Party should, working group should host a virtual watch party? You know how you go, someone else will plan it. I'm the person they make plan.
Yeah. Okay. See, now I'll bring that idea to
Okay.
someone who will actually want to do that. I want to do it. It won't be.
Work
Yeah,
that
we have
out.
a virtual watch party in Colorado. We have another one. We have a few of them going on. It would be kind of an interesting thing.
Yes, that would be awesome. I will bring that
love-
up at the meeting and see who takes that and runs with it.
Right,
I
right.
have
It's
a
like-
couple ideas. I know some of our members will be
Right.
like, "Oh, I'll do it." I'll be like, "Thank God."
Thank God. It's like, yeah.
Next year, you know, as I told Heather, next year I'm teaching everybody how to play. I'm going to teach all 500 of us how to play pickleball. It's going to be great.
Go all. Yeah.
All right. We will be back here next week with Wendy Van Buren and Zarik Khan. It is a partnership with the International Endometriosis Imaging Congress, and we will chat all about imaging, which is something that really could push the narrative forward. That is Dr. Van Buren's goal with her new society, to really start challenging the local radiologists to learn some of these new techniques. So that is
So
next
important.
week. Good night, everybody.
Having me.
Sorry about
Thank you for
the sound.
coming. Thank you.
Thank you for having us. Happy New Year.
Happy New Year.
Bye, everybody.